Hi everyone, welcome to ABA with ABS. I'm Lisa. I'm coming to you today live on location from my kitchen. We are in a time of uncertainty and change. Lots of families are feeling fear, financial insecurity, and instability during this difficult time. Schools are closed and options are dramatically limited for children to keep themselves busy. This can lead to many issues and problems for children and families, especially for families of children with disabilities. That is why today we are going to talk about telehealth. If you are a client with us, your BCBA has probably already contacted you about telehealth. Maybe you've had some questions, and maybe you even wondered if telehealth will work for you and your family. Today, I'm here to answer those questions. So let's start with what is telehealth. Telehealth is the provision of services in which the teacher, the BCBA, or the therapist is in a different location than the child. It involves communication through some sort of technology, such as telephone or video conferencing. Will telehealth work for my child? That is a normal and very natural question, and it's very normal for people to be skeptical or nervous about using telehealth. But research and reports from many parents and professionals have shown that telehealth can work as well, if not better in some situations, for children and their families than traditional in-person services. Telehealth can work for a wide variety of learners, including early language learners, young children, non-vocal children, and even older children and adults with advanced conversation skills. Telehealth can work for children that have short attention spans and have a difficult time staying on task or even staying seated in a chair. And telehealth can definitely work for children with problem behaviors. Some families have been using telehealth for years, and some have even left traditional in-person services for a strictly telehealth model because they feel it works better for them and their family. The short version is telehealth can be flexible for the needs of your child and you and your family situation. What does telehealth require? Well, the great news is nothing more than what you have already in your house and maybe a couple of free apps. Due to the difficult situation we are in now with social distancing and quarantines, HIPAA has released some of the guidelines and are allowing us to use free, easy-to-access apps such as Skype, Zoom, Facebook Messenger, and FaceTime. You can also use telehealth with your telephone. Some families find it helpful if they have a Bluetooth headset to use that as well, but it's not necessary. What skills can be worked on using telehealth? Pretty much anything that you need for you and your family. Telehealth has been successful at teaching language skills, social skills, academics, daily living skills, life skills, and even reducing behavior skills. Extensive research and reports show that telehealth can be effective at teaching children and helping their families with any of their needs in the moment. Do I have to become my child's therapist? This is a very common question for parents, and I'm here to ease your mind and tell you, no, you don't need to become your child's therapist. In fact, your BCBA will help you develop a plan that allows you to work around the routines and needs of your household currently. In some situations, there may even be a therapist who will be working with your child via telehealth and distance learning. So how does telehealth work? Well, first, your BCBA will contact you to discuss telehealth and a way that we can implement this that is effective for your child, you, and your family situation. You will discuss with your BCBA the main priorities right now for you and your child. Chances are these have changed dramatically over the last few weeks, and that's okay. We are going to work with you on what you need right now. You and your BCBA will also discuss any barriers that you may have towards implementing telehealth, and your BCBA will help develop a plan to work around and to circumvent those barriers so that telehealth is effective for you. Next, your BCBA will work with you to develop a schedule that's effective for you and your child and that works around all of your other needs. The sessions may initially start very short and gradually work up. They may involve another caregiver, such as a grandparent, babysitter, or even a sibling. Your BCBA will start by training you on any of the basics that you need to implement the strategies that you will be doing with your child. Don't worry, they will be simple and catered towards your needs. Once you have been trained on the basics and you feel comfortable, we are ready to start incorporating your child. Sessions may start slowly and have lots of breaks so that your child can learn to focus. Your BCBA will also continue to provide coaching and support to you or the caregivers involved, either before, during, and after your sessions. And your BCBA will take time to speak with you at a time that's convenient for you, at least once a week, or sometimes even more, to discuss what you feel like is going well with telehealth, your child's progress, and any problems that you feel are arising in the telehealth sessions. We can be flexible and we'll work around your needs and your values. Another question that many families have is telehealth covered by my funding source? If you are receiving services through us, through your insurance company as a payer, the answer is that every insurance company has different requirements for telehealth. Luckily, most of these requirements have been dramatically loosened to accommodate these difficult times. Your BCBA and our office staff will work hard with you and your insurance company to determine exactly what benefits you have and what type of telehealth we can offer. So as you can see, telehealth can be very flexible. I have just answered just a few of the most common questions about telehealth today. However, we are happy to provide you with references and additional resources on telehealth, and again, to work with you to make this flexible and work for you and your family. If you have any additional questions, feel free to reach out to us at any time, and we are happy to arrange a conference to talk with you about it more. Again, thanks for tuning in to ABA with ABS, and stay well.